Hello and welcome to your Tuesday One show live on BBC One and iPlayer with Lauren Laverne.
And Jermaine Genus.
Hosting a breakfast radio show and waking up the nation is great fun. Getting up in the middle of the night is anything but. I thought that might be why I was tired all the time. Then late last year, I realised something wasn't right.
I, at one point, thought it could be narcolepsy. It wasn't until only a few months ago that I was diagnosed with sleep apnea, which means that when I go to sleep, my breathing stops and starts.
I use a CPAP machine, which pumps air into a mask you wear over your nose and mouth while you sleep, keeping my airways open. Obstructive sleep apnea affects at least 1.5 million people in the UK, according to the British Lung Foundation.
Michael, please.
Mike in Cardiff is one of many whose condition not only affects him, but takes its toll on partner Kelly too.
Kelly, how has this affected you?
Really bad, because I have to try and keep myself awake to bring him back around. Michael.
It must impact your relationship, right?
Because I don't get a full night's sleep when I'm tired for the day, it causes arguments. So it is a really big strain.
You know, Mike, you've been using the CPAP machine. How have you found that?
It's really comfortable at first, because you're not used to something on your face when you're asleep, and you're constantly in your sleep trying to take it off.
When we last had him, he stopped breathing 109 times an hour.
109 times an hour?
Yeah.
Wow.
If a GP thinks you might have sleep apnea, they may refer you to a specialist sleep clinic, like this one that Professor Bhik Kotecha works at.
So both snoring and sleep apnea occur because there's a turbulent airflow, but there are factors that would aggravate matters. So things such as alcohol, large tonsils, obesity, large tongue, receding chin. If it is moderate or severe and you leave that untreated, it has a higher risk of developing dementia, cognitive dysfunction like memory, concentration, type 2 diabetes, ischemic heart disease.
I've asked the professor to see if he can help both Mike and Kelly get a good night's sleep.
So if I were to ask you when you wake up eventually, was that sleep refreshing, Mike?
No.
And have you fallen asleep at work?
Absolutely.
Okay, so those are the features that would worry me.
And after a closer look, Professor Kotecha is confident he knows why Mike struggles so much with the CPAP machine.
So your tonsils are massive, and there's no way you're going to be able to use CPAP because the pressure that is required for the CPAP to push the tonsils apart, the pressure requirement will be quite high.
Yeah.
So if Mike can't use the CPAP machine, what are the alternatives?
We have a variety of other options. You might want to go for a device called night shift. If it notices that you're sleeping on your back, it'll cause vibrations and it'll wake you up.
Yeah.
And you sleep on your side. Then this is called Excite-OSA. You use this before you go to sleep. And then it'll stimulate the tongue and tone the tongue muscles.
Then suddenly, just how much Mike's sleep apnea is affecting him becomes very apparent.
He's falling asleep. So you're tired, you fell asleep?
Oh.
Okay, so you're obviously struggling quite a lot to keep awake as well.
The professor sends Mike and Kelly away with the devices to see if they can help.
So tonight I'm going to try the Z-Bud Plus Nasal Dilator.
Over the next few weeks, Mike tries out each of the products.
We'll see how we get on with it.
With little success.
Michael, breathe. Thumbs up or a thumbs down? I've got to physically shake you to breathe.
So Mike is opting for the professor's final solution, surgery. It's the last hope for Mike.
I'm hoping to have my tonsils out soon. I've got an appointment now with my doctor at the end of the month to discuss having them removed, so I've got a bigger airway, and then we'll go from there.
Yeah, well, thanks to Mike and Kelly for sharing their story with us. And if you want more information, please head over to our website.